Hello, everyone. Welcome to LUMP, TCM and Acupuncture Basics. Let's start with the first topic. Let's welcome Mom Needs You, certified acupuncturist from Silang, Cavite, Philippines. Good afternoon, Mom Needs.
Good afternoon, Doc Hector. Good afternoon, everyone. How's my sound, Doc? Audio ko.
Very clear po.
Okay, thank you. So, the topic of today, blood, shwe, 15th days na natin. So, here, merong patient, male, 33 years old. Yung tang description, deep red, especially in center, wide shape, deep red tip, whitish, slippery coating at the sides, dirty yellow coating at the center. So, yung symptoms na meron siya, severe heartburn, stomach pains, may insomnia and nightmares, may inner restlessness, panic attacks, and meron siyang excessive sexual drive. Okay? Western diagnosis, wala. Background to disease, yung excessive use of alcohol, coffee, and nicotine, and excessive masturbation. TCM diagnosis, kidney yin deficiency with stomach fire, internal heat and toxin due to alcohol, heart fire, long-standing accumulation of phlegm or phlegm fire. Okay? Let's go to Scarlet Red Tongues. This tongue body color is deep red with slight pink hue. If tongue is dry or without coating, it is kidney deficiency with vigorous internal heat. Occasionally, only some areas of the tongue will present with this shade, most commonly anterior third of the tongue. So, tingnan nyo po, yung dila. This discoloration corresponds to severe lung and stomach yin deficiency. Scarlet red tongues with coating are characteristics of warm febrile disease. Okay? May patient tayo dito again, 22 years old female. Tongue description, scarlet red, dry, rough coating, notch at the tip. Okay? Ang symptoms na she is presenting is dry, red, itchy skin, fits of anger, and there is depression. Okay? Western diagnosis, atopic eczema, background to disease, lack of sleep, irregular lifestyle, alcohol abuse. Okay? TCM diagnosis, heat in the blood, slight kidney deficiency, and slight heart blood deficiency. So, study na lang po natin kung ano. Another patient is a male, 33 years old. Tongue description is scarlet red, tongue, raised. There is reddish dots. There are reddish dots. Observe po nyo. Distributed over the entire tongue. There is a long vertical crack. Symptoms na meron siya, inner restlessness, tremor of hands, poor memory. Okay? Ang Western diagnosis, wala rin. Background to disease, he is drug abuser, heroin, cocaine, and ecstasy. Dami naman. Mayroon siyang lack of sleep, overwork din, and works with toxic substances. Yung TCM diagnosis, kidney deficiency, heat in the blood, constitutional weakness of the heart, and heat in the heart. Okay? Okay. Let's go to red short tongues. This tongue type indicates severe exhaustion of kidney and liver yin plus development of vigorous heat. Sobrang heat. This can lead to very serious disorders as extreme heat. It consumes the fluids and yin. So most serious being internal movement of wind. Okay? Sobrang ano siya. The tongue is short because fluids, blood, yin are not adequately nourishing the tongue muscles. Tongue loses its elasticity and its ability to move freely. If tongue deviates on one side, this indicates internal wind. Okay? Although this type of tongue is result of severe yin deficiency, treatment with pure tonification is not indicated. Internal wind must be extinguished and yang must be sedated. Okay? Po, yung pang treatment. So there is another patient, female, 19 years old. Yung tongue description niya ay red, small, and short. Very pointed, prickles at the tip. And mayroong intense red edges. So tingnan po niyo mabuti. Ang symptoms na meron siya ay lack of appetite, may constipation, amenorrhea, strong inner restlessness, merong insomnia, and may suicidal fantasies. Ako, delikado. Okay? Ang Western diagnosis niya ay anorexia nervosa. Background to disease, serious starvation, divorce of parents. Meron palang emotion din, no? So, ang TCM diagnosis po ay kidney deficiency, onset of essence deficiency, heart fire, and heat in the liver. Okay, thank you very much.
Thank you very
Ivan,
much,
Doc.
Ma'am Needs. Let's now fly to Legazpi for the next topic. Let's welcome Sir Dino Pinheiro. Good afternoon, Sir Dino.
Good afternoon, Doc. Good afternoon po sa lahat. Now we go to the climatic pathogenic factor, part 6. Next, we have the dryness, which is the climatic dryness mostly affects organs of the metal element, which is the lung and large intestine. Sa first tower diagram, the symptoms of dryness in lungs and large intestine are dry mucous membranes, dry skin, and dry stool. So, mababa po yung yin. So, sa treatment, we have to tonify the yin. Sa next tower diagram, we have decreased ang yin. And so, when the yin decreases and cannot control the yang, it would rise from time to time. So, yung yang ang tumataas paminsan-minsan. This would result in sneezing, nosebleed, dry and strong cough, dry painful stool, with bleeding or hemorrhoids and itchy skin. Sa treatment, we need to tonify the yin and sedate the yang when needed. So sa treatment, dryness can manifest in any organ. Symptoms of dryness are dryness with recurrent heat. So we need to increase water intake and humidify the rooms. All climates are positive with excessive cold or heat. But dryness is a negative climate with lack of water. While exposure to other climates initially increase energy in our body, dryness consumes our fluid, thus making us yin deficient. Okay, sa dryness example, we have dryness in the kidney. Decrease po ang yin, normal ang yang. Osteoporosis carries of teeth, receding gums, thinning or loss of head hair, atrophy of nerves, Alzheimer's disease, general dryness of body, concentrated urine, kidney yin deficiency can lead to ascending heat to the upper body. So treatment, we use kidney 7, kidney 10 to tonify the yin. Drink more, rest more, avoid heat, lung 7 and spleen 3. Next, we have dryness in the liver. Ganon din ang tower diagram. There is brittle nails, dry eyes, nervous, tension, tremor when nervous, contractures of tendon like Dupuytren's, rupturing tendons, problems to extend joints. Liver yin deficiency can lead to recurrent conjunctivitis or tendonitis. Sa treatment, we use liver 3, liver 5, liver 14. Kidney 7, lung 7, increased milk and oily food, sweet and sour fruits, fish oils. Next, we have the fire heat. This is a factor mostly affect the organs of the fire element, which is the pericardium and the triple warmer. Sa tower diagram, yung yin mababa, while the yang is excess. This is the fire heat in whole body. Symptoms of fire heat, there is disturbance of the mind, hyperactivity, delirium, incessant speech, hot with very little sweat, disturbance of the blood, excessive and spontaneous bleeding, epistaxis, vomiting blood, burning, etc. Dispersion of heat, there is a skin infection, carbuncles, red and hypersensitive skin. Sa treatment, we use PC6, Do20, Extra 6, UB62 tranquilizing points. REN3, REN12, REN17, lung 7, tonify REN channel. We have to have water and rest. If very serious, sedate DOOT channel, we use small intestine 3 sedation. Symptoms of fire heat are caused by prolonged exposure to high heat or exposure to heat when yin of the body is in a weak state. The yin cannot control the yang, which rises upward and outwards. This explains the hyperactivity and restlessness of the mind, upward, and the redness, heat, and hypersensitivity of the skin outwards. The body cannot balance the energies by increasing the yin as the yin is very weak. The only possible way that the body can attempt to balance itself is by eliminating the heat. The quickest and effective way to achieve this is by eliminating blood. As bleeding occurs, the body temperature is reduced, as letting out blood is a way of eliminating heat. Thank you po for listening.
Thank you very much, Sir Dino. Up next is yin-yang relationships. We will continue with our discussion of interconsumption. We now come to example 3 for yang consuming the yin. Alcohol increases liver yang. So initially, the liver yin can increase. So this is what you call the hangover. In due course, liver yin is consumed. This will cause symptoms of contractures of the muscles and tendons, tremor, dry eyes, lack of control over anger. Deficient liver yin cannot control the rising liver yang. Liver yin stores blood, and when yin is deficient, there could be spontaneous and excessive bleeding, as in the case of when you have liver cirrhosis. Then finally, a reduced state of blood and qi at the end of bleeding. Treatment: sedate the liver yang, tonify liver yin. We use points to hold the blood within vessels and other points against alcohol abuse. We go to example 4. This time we have yin consuming the yang. So, firstly, cold or damp exposure over a period of time. Initially, the yin increases. Secondly, the yang will take over, will try to counter. The yang rises, so this will cause symptoms of inflammation or fever. So this would be the pathogenic yang. Thirdly, the functional qi or the good yang is consumed. So there will be cold and damp exposure consuming the warmth and inhibits the functional yang or qi. So in the case of an inflammation, the pathogenic heat remains high. So the inflammation is the harmful heat, while the good functional yang is, as you can see here. So this is slowing of functional yang qi, or function or qi deficiency caused by long-term cold or damp exposure. So we tonify the functional yang or qi by using the bakshu points and luo connecting points, sedate the yin. If the heat or inflammatory symptoms do not disappear, we add bloodletting or electrostimulation locally in order to either eliminate or disperse the heat. Then we go to yin consuming the yang, exposure to cold. Cold, we know, it can increase the kidney yin. Then the yang increases, causing fever, arthritis, backache, ear infection, pyelonephritis, cystitis. There is a definite history of exposure to cold, and the patient continues to feel very cold, even with the fever. So the inflammation, you'll have yang pain and fever, and the functional qi is reduced. Lastly, the functional qi goes down, while the infection, the pathogenic yang, is still present. So symptoms of qi deficiency will have stiff joints, poor flexibility of back, loss of hearing, water retention, or incontinence. A continued state of inflammation will inhibit the normal functional qi. It is always the healthy yin and yang that are consumed, not the pathogenic energies. So treatment, bladder 23, bakshu point of the kidney, which activates function. Bladder 58, the luo connecting point of the urinary bladder. The patient should be advised to keep warm, although no moxa should be used. Bleeding cup to eliminate pathogenic heat. Electrostimulation to disperse heat can be used in local areas if necessary. Thank you very much for your attention. We now go to the 5 elements. Let's call once again Sir Dino Pinheiro from Legazpi. Good afternoon, Sir Dino.
Good afternoon, Doc. Good afternoon po sa lahat. Now we go to the fire element part 6. Insomnia. In all cases, we use DO20, Amnian 1 and 2, PC6, UB62. Okay, so first tower diagram, there is an excess of yang in heart and in kidney. There is a decrease in yin. There is pale face with red cheeks, restless person, talks too much and too fast, active mind, tachycardia or anxiety related to insomnia, dream disturbed sleep. Sa points we use, we add REN 14, heart 5, small intestine 8, and we sedate. Kidney 7, and drink a lot of water. Cool blue room. Next, we in the next tower diagram, sa liver, there is an increase in yang. So ascending middle warmer, usually liver yang increase, ascending upper warmer. Loud voice, tense, red-faced person, can sleep after 3 a.m. Headache associated with insomnia, may be hypertension. Sa treatment, we add GB34 sedation, lung 7, liver 3, spleen 6 descending, and we do breathing exercise to relax. Next tower diagram sa heart, both the yin and yang is decreased. We have pale face, hypotension, arrhythmia, anemia, talks much and laughs about nothing, feels tired but mind becomes active as head touches pillow, cold sweating of hands, depression, early morning waking. We add points REN 14, UB 15, lung 1, UB 13, spleen 10, UB 17. Treatment for chronic insomnia must be given every day for 8 to 10 days. So, halos araw-araw po. The treatment should be given in the evening. Semi-permanent needles on earth, shenmen, or the heart could be used. Hyperinsomnia, narcolepsy. Sa treatment, we use do-26, kidney 6 needle, and moxa. Sa first tower diagram, we have heart blood stagnation, which is higher po yung yin. More sleepy, if too warm or too cold. Sleepiness, worse after long sleep. Bored and boring person, dull, drawling speech, deep voice, large cyanose tongue, teeth marks, slow, full, and slippery heart pulse. Sa treatment, we use UB15, SI7, which is the low point, spleen 9, GB37, and do physical exercise. Next tower diagram, we have the spleen and stomach chi decrease. The yin is normal and decrease po yung yang. More sleepy after meals or in wet weather. Sleepiness, worse if eating much. Edema of eyelids, hands, and feet. Teeth marks on tongue, slippery pulse in spleen position. Sa treatment, we use REN12, we use moxa, UB20, UB21, UB39. Stomach 40, spleen 9 if obese, small meals, unrefined carbohydrates, and cooked warm meals. First, we use 2 sessions weekly for 4 sessions. Next, 1 session weekly, about 2 sessions. Then lastly, 1 session for fortnightly, 2 sessions. Thank you po for listening.
Thank you very much, Sir Dino. We now go to the 5th presentation, essence or Qing. Essence as basis of kidney qi. Essence is fluid-like. It has natural affinity with yin. So we consider essence as the aspect of kidney yin. It provides the material basis for kidney yin to produce kidney qi by the heating action of kidney yang. The kidneys are compared to a large cauldron full of water. The fire under the cauldron is provided by kidney yang and Mingmen, or gate of life. The water inside the cauldron corresponds to kidney essence. The resulting steam, that is the qi, corresponds to kidney qi. Kidney essence is necessary for the transformation of kidney yin into kidney qi through the warming action of kidney yang. So here you could see the relationship between kidney yin, kidney essence, kidney yang, and kidney qi. Essence produces marrow. The concept of marrow in Chinese medicine is different from that in Western medicine. It does not correspond directly to the bone marrow. The essence produces marrow, which in turn produces bone marrow and fills up the spinal cord and brain. Thus, the marrow is a substance, which is the common matrix of the marrow, the bone marrow, the brain, and the spinal cord. And there is no equivalent in Western medicine. Essence is extremely important for healthy bone marrow, brain, and spinal cord. And brain is called the sea of marrow. If kidney essence is weak, the brain lacks nourishment. Person may lack concentration and memory and suffer from dizziness and feeling of emptiness of the head. Essence determines our basic constitutional strength and resistance to exterior pathogenic factors. Although defensive qi is mostly responsible for protection from exterior pathogenic factors, it draws its strength and has its root in the kidney essence. Thus, kidney essence also plays fundamental role in protection against exterior pathogenic factors. If the essence is properly stored, but not dissipated, no exterior febrile diseases will be contracted in spring. If essence is not stored in winter, the exterior febrile diseases will be contracted in the spring. From these four main functions of the essence, one may deduce the kind of problems that may derive from a deficiency of essence. So let's summarize the functions of the essence. So growth, reproduction, and development. So if you have kidney essence deficiency in children, this will result in stunted growth, poor development, infertility, habitual miscarriage, mental retardation in children, bone deterioration in adults, loose teeth and hair falling out or graying prematurely. The essence as basis for kidney chi. So you will have poor sexual function, impotence, weakness of the knees, nocturnal emissions, tinnitus, and deafness. The essence as the basis of marrow. Poor concentration, poor memory, dizziness, tinnitus, and a feeling of emptiness of the head. And finally, the essence as the basis of constitutional strength, being constantly prone to colds, influenza, and other exterior diseases, allergic rhinitis. Thank you very much for your attention. Up next is Zangfu organs. Let's call on Ma'am Nits Yu of Silang Cavite. Once again, Ma'am Nits, good afternoon po ulit.
Good afternoon ulit, Doc Hek. Good afternoon, everyone. So the topic for today in our Sangfu organs is liver functions. Okay. It ensures smooth flow of qi, stores blood and regulates its volume, controls the sinus, opens at the eyes, manifests in the nails, houses ethereal soul or hun. Emotion of liver is anger and frustration. Okay? Yan po ang functions. So let's tackle one by one. Liver ensures smooth flow of qi. Each organ has a certain direction of activity. Qi of spleen flows upward. Qi of lungs and stomach flows downward. Okay? Liver ensures smooth movement of qi in all directions, ensuring normal mental and emotional activity. Is also secretion of bile. Maganda siya kapag normal. Okay? If liver's function of free coursing is impaired, it leads to stagnation of liver qi. Stagnant liver qi can attack other organs and reverse their natural flow of qi. Remember yung mga flow, okay? If liver invades the stomach qi ascends and down-bearing function of stomach is disturbed. So magkakaroon ng heartburn, nausea, and vomiting. Okay? Yung healthy spleen and stomach function rely on free coursing action of the liver. Qi of the spleen bears upward and qi of the stomach bears downward. Okay? Yan po yung function nila. Liver governs harmonious flow of emotions. Pagka na-impair yung function na to, magkakaroon ng emotional disturbances and magkakaroon ng mental depression. Okay? Liver plays a role in harmonious relations of human being and its environment. Person is able to adequately respond to situations. Okay? Pag healthy ang liver. If liver function is impaired, human being loses this ability to react adequately. Overacting may occur. Impairment of liver qi dynamic can affect emotional activity. Okay? Emotional disturbance may similarly affect qi dynamic. This reciprocal relationship is often seen in TCM. Certain situations in our lives that we do not like but endure can create emotional tension. So, nagkakaroon ng disturbance of liver qi. Okay? Tensions, yung muscular or emotional, it can result in liver qi stagnation. So, magkakaroon ng irritability, frustration, mental depression. Okay? Organs most affected by emotional disturbances are liver and heart. Okay? Dalawang organ na yan. Sometimes it is difficult to differentiate if emotional disturbance are caused by liver qi stagnation or by heart fire. Signs can be interpreted by practitioner as emotional tension or inner unrest. So remember, okay? Analyze mabuti. It is important to diagnose correctly in order to treat the root of emotional disturbances. The liver isn't always the only organ involved. Insecurity or dissatisfaction can be cause for emotional tension too, which means that kidney and spleen are involved as well. Okay? Treatment principle, kapag mayroong walang smooth flow of qi, movement of liver qi, tonification of kidneys and spleen. Yan po yung gagawin yung treatment. Okay, hanapin po ang points. So, liver ensures harmony of menstruation. Yan, sa menstruation, dyan siya. The two liver functions are involved in menstruation. Yung harmonious flow of qi and regulation of blood volume. Okay. Liver blood is responsible for quantity and strength of menstrual bleeding. If liver blood is deficient, menstrual bleeding is scanty. O konti lang. Okay? If liver blood stagnates naman, menstrual bleeding is dark, including the clots. If there is heat in the blood naman, movement is reckless and blood is driven out of vessels. So, nagkakaroon ng bleeding disorders, yung abnormal uterine bleeding. Okay? If the free flow of qi is impaired, signs like breast tenderness and irritability associated with premenstrual syndrome or the PMS will appear. Okay? So, another function, liver stores blood and regulates its volume. Liver is able to retain blood and regulate amount of blood in the body. Amount of blood in various parts of the body varies according to physiological needs. Okay? During physical activity, blood is distributed throughout the body, meeting increased need for nutrients. When body is at rest or asleep, blood flows back to the liver to be stored. Okay? When liver's blood storing function is disturbed, example niyan yung blood deficiency, amount of blood is reduced and there is not enough blood in the body to supply all the needs. Okay? Blood deficiency, yun yung kulang na ng dugo, manifest as numbness and tingling in the extremities. These sensations are likely to be first noticed at night or when resting, since the amount of blood is even more reduced during rest and in inactivity. Okay? Other signs include blurred vision and vertigo due to inability to supply blood to the brain quickly enough when changing position. Okay? So thank you everyone for your attention. I hope you learn.
Thank you
po,
very
Doc.
much, Ma'am Needs. Yeah, I'm sure they have learned a lot from the presentation. So let's now proceed to the meridian theory, and let's welcome once again Sir Dino Pinheiro.
Good afternoon, Doc. Good afternoon po sa lahat. Now we go to the spleen channel of foot yin part 2. Now we have the spleen 6, which is located through 3 tune proximal to the highest prominence of the medial malleolus on the posterior border of the medial crest of the tibia. Sa point explanation, the most important point on the meridian, it is the area distal point for the lower abdomen, used in all problems of the urinary system and the reproductive system. It is the meeting point of the 3 yin meridians of the foot and is used to tonify the general yin in the lower body. Next, we have the spleen 7, which is located 6 June proximal to the highest prominence of the medial malleolus on the posterior border of the medial crest of the tibia. Point explanation, an analgesia point for the perineum used in painless childbirth with acupuncture, together with the point spleen 6. Both points are used in one leg with electrostimulation when the patient begins to feel pain in the perineum. A dense dispersed frequency is used so that the patient does not get used to the stimulation. Next point, we have the spleen 8, which is located at 3 June distal to the junction of the shaft and the medial condyle of the tibia. Spleen 9, at the posterior border of the medial crest of the tibia. Point explanation, we have the C-cleft point on the meridian and a symptomatic point for the dysmenorrhea. It is also effective in premenstrual breast distension. Next point, we have the spleen 9, which is located in a depression distal to the medial condyle of the tibia at the junction of the shaft and the medial condyle. Point explanation, also called the LASIK point. It is used to eliminate excess fluid and works well in all cases in which the kidney function is normal. The effect is very quick and the patient cannot wait to get to the toilet once the needles come off. The location of points spleen 6 to 9 is described as behind the tibia in most books, and this is absolutely correct. Let the liver meridian and kidney meridian have the same description of pathways. Therefore, we have to differentiate these three as much as possible. If not, we will be creating a new symptoms instead of curing the old ones. The liver meridian is the most anterior and flows almost at the posterior edge of the tibia. The spleen meridian is in a good hole behind the tibia, and the kidney meridian should always be directly in a line above the kidney tree, which is in the middle between the prominence of the medial malleolus and the Achilles tendon. Next point is spleen 10, which is located with the knee flex. Spleen 10 is located to June proximal and slightly medial to the medial superior border of the patella, in a depression on the vastus medialis muscle. Point explanation, a symptomatic point for allergy and pruritus. It is a point used to clear blood heat and clean and purify the blood. Hence, it is also good against skin infection, acne, eczema, etc. Next point, we have the spleen 15, which is located 4 June lateral to the center of the umbilicus. Point explanation, not a commonly used point, but good against ascariasis. Next point is spleen 21, which is located on the mid-axillary line in the 6th intercostal space. Note, according to some texts, this point is located in the 7th intercostal space. Point explanation, the major Lu connecting point of the spleen. The Lu point of the yin meridian can tonify its yin and reduce the yang. So it is the best point in hyperactive yang state. However, the spleen channel has two Lu points and two connection to its coupled organ, stomach. Spleen 21 is used in cases of hyperactive yang in the stomach or esophagus, such as hyperacidity and acid reflux, worse when hungry and better after bland food. It is also the last point and exit point of the meridian before it connects to heart 1. Thank you po for your attention.
Thank you very much, Sir Dino. We now come to the last topic, still on breathlessness. We'll discuss the patterns. Lung and kidney deficiency, clinical manifestations, chronic breathlessness, attacks brought on by exertion, difficulty in inhalation, loss of weight, depression, edema of ankles, cold limbs, lower backache, dizziness, and weak knees. The tongue is pale and swollen, the pulse deep, weak, and slow. This condition corresponds to yang deficiency of both lungs and kidneys, with the kidneys unable to grasp the qi. It results in the situation described in Chinese medicine as fullness above and emptiness below. That is, deficiency of the kidneys with relative fullness of the lungs. This is due to kidney yang deficiency. Hence, we have edema of the ankles, cold limbs, weak knees, dizziness, depression, pale and swollen tongue, and deep and weak pulse. As kidneys control inhalation, typically the patient would find it more difficult to breathe in. Treatment principle: tonify and warm the kidneys, stimulate descending of lung qi. Points: bladder 23, kidney 7, do 4, kidney 25, kidney 3, lung 7, and bladder 13. We use reinforcing and moxa. Bladder 23 and kidney 7 tonify kidney yang. Do 4 tonifies the fire of the gate of life, the Mingmen. Used with moxa, do 4 strongly tonifies the yang. Kidney 25 is an important local point to relieve chest fullness and breathlessness caused by kidney deficiency. Kidney 3, source point, tonifies the kidneys. Lung 7 stimulates descending of lung qi. Bladder 13 tonifies lung qi. Case history. We have a 48-year-old woman suffering from breathlessness for the previous 10 years. She found it difficult to breathe in, and the condition was worse at night. Breathlessness seemed to have started after her being caught in a dust storm in the Middle East, following which she contracted bronchopneumonia. She had had pneumonia previously as a child. She had also experienced fluid retention in the abdomen and ankles for the previous 10 years. She was often constipated and felt cold in the legs. Her pulse was fine and deep, particularly weak in both rear positions. Tongue was pale and swollen and had a sticky white coating. So here is the tongue of the patient. So pale, swollen, especially the front third, and sticky white coating. This is a clear condition of breathlessness from lung and kidney yang deficiency. She obviously had weakness in the lungs since childhood, deriving from the pneumonia, later aggravated by the bronchopneumonia 10 years before. Because of her age, kidney energy started to decline, and combining with the lung deficiency triggered off the onset of her breathlessness. Kidney yang deficiency is confirmed by the fluid retention, constipation, cold feeling of the legs, and the very weak pulse on both rear positions. The lady was treated with both acupuncture and herbs. Acupuncture treatment was very simple, basically aimed at tonifying the lungs and kidneys with stomach 36, spleen 6, bladder 13, do 12, bladder 23. The directing vessel opening points were used every time. That is, we have lung 7 and kidney 6. Lung 7 on the right because the patient is a female, and kidney 6 on the left to tonify lungs and kidneys. Thank you very much for your attention, everyone. and hope to see you in our next presentation. Thank you.